Report is such a personal thing. You are never going to make everybody happy.
It's
You
true.
are never going to make everybody happy. It is what it is. Like, you do what will make you, just like you said, a prudent nurse. And you can never, ever, ever go wrong about that. If somebody's mad because the report was too long,
Oh,
sorry
get
about
over
it.
it.
If they're mad because it was too short, sorry about it. Like, everybody has different ideals of what that's going to look
Yeah,
like.
at the end of the
Everybody.
day, we all are just trying to do our best, or we should be,
Hmm.
right? And, trying not to cut corners and trying to make sure that we have integrity. I think for students, like, this is why I will preach this to my students over and over again, is like, we care about your integrity, because at the end of the day, nobody's going to be with you at the bedside for everything, right? It's you and your patient. It's so we get down to brass tacks of like, if you break sterile field, are you going to fix it? Are you going to go and get a new catheter? Are you going to, you know, fix the problem? If you drop a pill on the floor, are you going to pick it up and give it to them? I know we all get tempted with different things like that. The question is like, what are you going to do? What
Hmm.
does your integrity tell you to
Yeah.
do?
Where
What
does
is
your
the right
integrity
thing?
lie?
Yeah, where is it? And like, I can keep giving all my meds late. I can keep doing all those things. These are all integrity issues. They're all matters of like your heart, of like, where are you at? And sometimes I feel like, people cut corners because they feel overwhelmed or whatever. But if you're feeling that way, that's where you need to ask for help. And so I think our goal really here is to help switch you from being like that nurse who just makes it through a shift to being that nurse that's competent and good and high quality, right? I want to put out high quality nurses. I want nurses who pass
Yeah.
the NCLEX, and I want nurses who studied more than what they needed to study. I don't want just bare
Yeah.
bones. I
Yeah.
want a
I want
smart nurse.
nurses who aren't afraid to ask questions when they don't know,
Exactly.
right? I want a nurse who's confident, but not overconfident. Like, I want a nurse who knows what they know and is not afraid to admit what they don't know, because it's really
Absolutely. And
okay.
like, for me, like, I've done this a long time, but there's still stuff I don't know. There's still stuff that I'm asking questions, and I'm like, I want to know more about that. And even some of the stuff y'all have commented, like, I want to know more of like, how are you doing it in practice? And so I can learn and update,
Hmm.
my repertoire, by knowing more and learning more. But I want to be somebody where my colleagues look to me and they go, Nick knows things. He knows how to make stuff happen. But there's also those times where I'm like, I don't know. And I think that is a much better place to be, to where you can openly admit, like, I don't know how to make this better. How do what are your thoughts? How do we do it? And I think really good nurses complete their orders. They make it through their shift, sure. But great nurses really set goals for their patients and help move them towards goals. I think is the next level time management.
Hmm.